The top 50 heart or cardiovascular designation focuses on patient care. There's a lot of different rankings and things, and I think that the top 50 heart hospital focuses purely on clinical care. And so it takes away these other aspects of things like research and, are you educating residents, and just eliminates all of that and just says, how do patients you take care of do? How efficient is the care you provide? How good are the outcomes? And are the outcomes measured in practical terms, in terms of, do people get a surgery, recover, and get back to normal life? And so I think that it really distills it down to that one thing. I mean, do patients do well? Do they recover? Do they get back to normal life? It's been kind of a mission, I think, from not only Bronson's employees, but also from the organization as a whole. I think everybody's really been striving and has continued to strive for excellent patient care. And those awards, I think, really are the manifestations of the entire team focusing on how the patients in this community do with cardiac surgical care. The approach that I think we all take with patients is very simple. I think once we evaluate a patient, I think that we also make sure that any gaps we might have that might better be served by other specialists in our system are filled. And that goes without saying. The entire heart team at Bronson, I think, is committed to making sure that any pieces of information that are necessary for an optimal outcome, we get it before we make a decision. And sometimes if we get new information that means we have to make a change, we make that change. But I think that the reality is that the entire heart team, I think, does a great job at coordinating for patient care. I think we've got essentially all the experts we need at Bronson to make those decisions. Behind the scenes, there's always so much effort going on. I think that the office visit is often just the tip of the iceberg. The amount of effort that goes into coordinating with the anesthesiologist, making sure that the ICU nurses are, getting continued education, making sure that all the sort of the current and state-of-the-art care is being provided. All of that stuff, I think, takes up a significant portion of our time when we're not seeing patients. And so I think that the piece that patients see is they see their incision, they see the education that they get before, during, and after their surgical procedure. But all of the effort that goes into constantly improving all of those other elements of the system, I think, are hard to even understand or comprehend. But it's ongoing, and it never really stops. And I think that's the thing that patients should be reassured about, is that there's this never-ending commitment that seemingly has infinite enthusiasm for improving the system. And I think, again, I've been here 8 years, and it's never gone away. And it just keeps getting more and more focused on making sure we do better for patients.